The trial that was presented at ASCO last June showed that there was a small but statistically significant advantage to anastrozole in terms of this breast cancer-free interval. And when we looked at younger and older women, we saw an advantage only in the younger women who were less than 60 years of age. So for women 60 years of age and older, there was no significant breast cancer-free interval difference between the two treatments. The quality of life study that I'm reporting on today basically was a secondary endpoint in the trial. It was embedded within it, and we took the first 1,200 or so women who enrolled in the trial and asked them to fill out questionnaires about their quality of life and symptoms before treatment was started and every 6 months while they were on treatment. We also collected data in the post-treatment period, but we're not reporting on that today. And today I'm reporting on those results, which showed that overall both drugs were very well tolerated. There was no decline in physical or mental health with either of the drugs. There was no worsening of energy level, no depressive symptoms, no cognitive difficulties, and overall women did very well with both drugs. However, we saw key symptoms that we know are really representative of the side effect profile of both of these drugs. And for tamoxifen, we saw an increase in hot flashes and gynecological symptoms, and the hot flashes and sweats were measured with a self-report measure. The gynecological symptoms were vaginal discharge and itching, which were at a low level but were significantly worse in the women on tamoxifen. And for anastrozole, we saw an increase in musculoskeletal aches and pains, which were significant in both age groups and stayed elevated across the course of the 5 years. And we also saw vaginal dryness and pain with intercourse, which was worse in the women who were on anastrozole.